Chapter 10. The Heart. Review Test. 1. A 55-year-old woman presents with complaints of chest pain. She states that the chest pain predictably occurs when she climbs 4 flights of stairs to reach her apartment or when she has been jogging for more than 10 minutes. She is particularly concerned because her mother died of a myocardial infarction at 50 years of age. Which of the following best describes this patient's state? A. Arrhythmia, B. Myocardial infarction, C. Prinzmetal angina, D. Stable angina pectoris, E. Unstable angina pectoris. The answer is D. This is a classic case of stable angina, which is chest pain that is precipitated by exertion but relieved by rest. Stable angina is due to atherosclerosis of the coronary arteries. This patient has risk factors for ischemic heart disease, IHD. For example, cigarette smoking, hypertension, hyperlipidemia, diabetes, family history of IHD/coronary artery disease. Prinzmetal angina is intermittent chest pain at rest, and unstable angina is prolonged chest pain at rest. 2. Yesterday, a 60-year-old man presented to the emergency department with dyspnea, diaphoresis, and crushing substernal chest pain that radiated to his neck and left arm. When asked to describe the pain, he put his fist to the center of his chest and stated that it felt as if someone is squeezing my heart. An electrocardiogram demonstrated changes consistent with myocardial infarction, and serum troponin I levels were elevated. If the patient unexpectedly dies today, which of the following would almost certainly be found on histologic examination of the affected myocardium? A. Coagulative necrosis with neutrophil infiltration, B. Fibrotic tissue replacing infarcted tissue, C. No histologic changes, D. Slight swelling of tissue and change of color, E. Young fibroblasts and new vessels growing into the infarcted tissue. 2. The answer is A. By 24 hours well-developed microscopic changes of coagulative necrosis can be detected in infarcted tissue. There is loss of nuclei in cells and infiltration of neutrophils into tissue. 3. A 60-year-old man is discharged after being observed in the hospital for 4 days following a myocardial infarction. He returns to his normal activities, which include sedentary work only. This point in time following a myocardial infarct is noteworthy for the special danger of which of the following? A. Arrhythmia, B. Mural thrombosis, C. Myocardial pump failure, D. Myocardial rupture, E. Ventricular aneurysm. 3. The answer is D. Rupture of the left ventricle, a catastrophic complication of acute myocardial infarction, usually occurs when the necrotic area has the least tensile strength, about 4 to 7 days after an infarction, when repair is just beginning. The anterior wall of the heart is the most frequent site of rupture, usually leading to fatal cardiac tamponade. Internal rupture of the interventricular septum or of a papillary muscle may also occur. The risk of arrhythmia is greatest within the first 6 hours after myocardial infarct. Arrhythmias are the most important early complication of acute myocardial infarction, accounting for almost 50% of deaths shortly after myocardial infarction. Myocardial, or pump, failure and mural thrombosis are other complications that may develop as a result of permanent damage to the heart after infarct. Ventricular aneurysms may develop in the fibrotic scar within 3 to 6 months after myocardial infarct. 4. A 10-year-old boy presents with migratory polyarthritis involving several large joints, fever, and malaise. Physical examination reveals a new heart murmur and friction rub-on auscultation, and a painless nodule is detected on the extensor surface of the elbow. He had a severe sore throat approximately 2 weeks ago, apparently recovering without antibiotic therapy. The anti-streptol isino, ASO titer is elevated. Which of the following describes the most likely outcome for this patient? A. Development of mitral valve stenosis over many months to years. B. Development of mitral valve stenosis over the next few months. C. Increasing severity of the current symptoms and findings over the next few decades. D. Persistence of the current symptoms and signs over the patient's lifetime. E. Total recovery after 1 to 2 months with no further complications or sequelae. 4. The answer is E. This is a case of acute rheumatic fever. Acute rheumatic fever manifests most commonly in patients 5 to 15 years of age with migratory polyarthritis, pancreatitis, subcutaneous nodules, erythema marginatum, and sydenham cora. Decades later, severe valvular disease, often manifesting as mitral stenosis, may develop as a feature of rheumatic heart disease. In this chronic stage of rheumatic disease, fibrotic valves may become stenotic, insufficient, or both, but much more commonly, progression to cardiac valve complication does not occur. 5. A 9-year-old girl is diagnosed with acute rheumatic fever. Instead of recovering as expected, her condition worsens, and she dies. Which of the following is the most likely cause of death? A. Central nervous system involvement. B. Endocarditis. C.